How common is thumb arthritis?
It's the most common disabled arthritis of the hand. About 20% of the population over 40 is suffering from it. And it's more common in women. It's estimated about 1/3 of women over the age of 50 really suffer from it.
Why is that?
Because our hand is very important and we grip everything with our thumb. There's a lot of pressure on our thumb, and with time we lose that cartilage.
Right.
And so used to be more with knitting, with doing things with your hand, gripping. It's typically more common in the non-dominant hand, because the dominant hand does fine work while the non-dominant grab things.
And puts the pressure.
And puts the pressure on the thumb as you hold things while you do the fine work on it. So you're unable to grab things anymore. You can't grip things, it hurts. You can't open jars, you can't open doorknobs. You can't lift your pants.
It becomes a painful way to live.
It's pain every day. It's pain all the time.
It becomes a non-functional hand. You see, the thumb is what separates us from the primates. You know, the thumb, we evolutionized and it came off the plane so that we can really oppose and move the thumb more freely, and that's why we can grab things. So you use your thumb. You know, you're not thinking about your thumb function,
right.
but the thumb is one of the most important thumbs.
You don't think about it, you're absolutely
one of the
right.
most important fingers of the hand. As a matter of fact, it's one of the indications. If you ever have trauma to this, you really want to try to replan and put it together, because it's such an important part of the hand function. As you're using it so much, you're putting so much pressure and so much grind between the bones that creates an inflammatory process that leads to degeneration of the cartilage, and that causes pain and discomfort. And it causes anatomical changes. It collapses the joint. And so traditionally, the standard operation is to get rid of that diseased bone. You basically cut it out, and then you got to reconstruct that joint. And what we do is we take out a ligament, and we roll it up, and we put it back in there, and that's how we reconstruct this joint.